Department of Public Health is out with its most recent maternal mortality data report. It finds pregnancy-related mortality in Illinois was higher in 2021 and 2022 than in previous years.
Yeah, and in 2022, 103 women died while pregnant or within 1 year of pregnancy. It also says 91% of pregnancy-related deaths were potentially preventable.
New this morning, a local nurse shares some of the struggles that pregnant women and new mothers deal with and what's being done to help.
Yeah, WGEM's Sydney Lyerly joins us live now in Quincy with the details. Sydney, good morning.
Kyle, good morning. About a year ago, Blessing, which you can see here behind me, received a grant from the state of Illinois to help them tackle the problem of pregnancy-related death. The women's care coordinator here at Blessing says they have been using the grant to purchase extra medical equipment for pregnant patients. She says this includes things patients can take home to check their health from home. The grant has also gone towards their doula program. She says the doula program trains community members who can support pregnant women and help them feel more comfortable at their appointments. Blessing has trained 14 women in the community to be doulas, and she says support is the most important part of prenatal care.
A person who is pregnant is going to go through lots of physical and emotional and mental changes, and support is the biggest piece of that. So if we do have a patient that comes in often and doesn't have that support, we want to find somebody that can do that.
Zanger says a lot of maternal deaths are caused by substance use and mental health disorders. She says about 80% of women experience the postpartum blues, but if symptoms last for more than 2 weeks, she says it's considered a perinatal mental health disorder. If you have a friend or family member that is pregnant or is a new mother, Zanger recommends reaching out and asking about specific needs like meals or chore assistance. And Zanger reminds pregnant women and new mothers that it is okay to ask for help. Natalie, back to you.
Sydney, thank you. If you are planning on becoming pregnant, Zanger recommends focusing on your health before pregnancy. She says good exercise, proper nutrition, and seeing your medical provider on a regular basis will help you stay healthy during a pregnancy.